Well, there are many different aspects which are worth considering, but I think that from the point of view of the practical application, one of the major issues is the use of brain imaging in order to diagnose very early or even preclinically diseases of the nervous system, in particular degenerative diseases, for which we don't have at the moment effective disease-modifying therapies. I'm thinking in particular about dementia and Alzheimer's disease and other conditions for which nowadays using tools such as positive emission tomography or structural magnetic resonance, especially in one quantitative approach to the imaging, we can make a diagnosis which is very early and even preclinically in, for example, in the cases of members of families in which there is one affected proband. This, of course, is a very, very important question, and people used to be slightly embarrassed in the past when I answered this, because, of course, scientists have been pushing very hard towards the application of these methods for early diagnosis, and the typical question from the lay people is, what's the use of knowing that you might progress to a disease for which there is no effective prevention? And the standard answer has been, well, of course, science is advancing at very fast pace, so you can expect in the near future to have drugs which might be disease modifying, and of course these drugs should be applied to very early cases. And I think this is a quite reasonable answer. Recently there have been also other indications about the advantage of having an early diagnosis, for example, from the studies performed by the Institute of Psychiatry in London. That is, knowing early that you are most likely going to progress to a dementia has been shown to have a sort of protective effect in terms of the future quality of life of the patient and of the family. This is because of a very simple reason, and knowing in advance allows the family and the environment, of course the possibility is there, to put into action all sorts of preventive measures to reduce the impact of the disease. Think for example about behavioral problems, something that if the diagnosis is not made, may appear abruptly and so be much more disruptive in terms of the social adaptation of the individual. On the other hand, it's clear that there are also drawbacks of not having an early diagnosis. Think about all the practical implications, for example, in terms of testamentary capacity or in general the ability to go on to run a business, I mean, especially in the case of people who are affected by the disease early in their life. Oh yes, yes. This is a very common, relatively common issue which happens at the legal level. Typically, there are some decisions by the affected person which the family might find not appropriate, such as, for example, giving a large amount of money or of possessions to another individual which is not part of the family, and then the family starts legal action. And the issue is, the typical issue is whether the person at the moment in which he or she decided to do that was legally competent to do this. And of course this opens a very complicated question, because you don't know exactly at that point which was the cognitive status of the person, and of course you have some ideas about the typical trajectory of the disease, but as you know it can be extremely heterogeneous. So this is one of the cases in which the lack of an early diagnosis creates a lot of problems. this is of course a fascinating issue, and people are now really fascinated by that. Just you can just notice by the number of books appearing each month in which you have neuroscience on one side and some social issues such as decision making, economics, ethical choice, etc. I think this is a fascinating enterprise, and it's something which is going to really boom in the next years. Well, my only worry, if I must say, about this, about the attitude that some people have about this kind of approach, is that it seems sometimes that using brain imaging allows you to bypass the individual. This has been said explicitly by some of the people working in the field. That is, that with brain imaging, you can identify a pattern of brain activity and relate it to something which is happening in the external world. You know, the first successes in the SDS area have been related to linking a pattern of brain activation with a specific object. That is, I can look at your brain map and decide whether you are looking at the face or you are looking at the house. And of course, this is interesting, but doesn't have many deep implications. What the deep implications are present when you when you propose to use brain imaging in order to detect patterns of brain activation which are associated with mental contents that the individual is unwilling or unable to report. Well, the typical case is all the discussion about the use of brain imaging to show in order to detect lies. Another example is the use of brain imaging in order to detect, for example, patterns of emotional activation while subjects are engaged in certain situations with all the related problems, such as individual differences in the amount of emotional activation taken to indicate, for example, the amount of empathy, etc. I mean, it's clearly a field which is going to develop enormously in the future and will have very, very important ethical implications.